The way to remember these normal electrolyte values. Well, here's a saying here, and if it helps you to memorize them in this way, then great. If not, you can just write them out over and over again. However, you can memorize these values along with their units. Go to it. Here's a saying. Little Maggie is 1.6 to 2.2 years old. Maggie corresponds with magnesium. She ate 3.5 to 5 bananas. Bananas corresponds to potassium because bananas have lots of potassium. And drank 8.5 to 10.5 ounces of milk. Milk is calcium. Then she took a 135 to 145 hour nap. It's a really long nap. After swimming in the ocean. Ocean has lots of sodium chloride, so that's where we get our sodium, 135 to 145. When she woke up, she swam in a pool and then took a shower for 97 to 107 minutes to rinse the chlorine from her hair. That's our chloride. Maggie played for 2.5 to 4.5 hours, drawing DNA with its sugar phosphate backbone. That gives us our phosphate level of 2.5 to 4.5. If you're not familiar with DNA, it's double-stranded. It has the backbone here, which is a sugar phosphate backbone. The yellow dot is phosphate. The purple structure here is a sugar. So we say it's a sugar phosphate backbone. Learning the normal values is important as lab tests are used to help diagnose, monitor an illness, and the patient's response to treatment. Realize that depending on the lab standards used in a particular lab, the values will be a little different, especially if they use different units. That's why it's real important to pay attention to the units. The goal is to get you to the point where you can analyze laboratory results, where you're going to be able to recognize an abnormal result, and most importantly, understand how the normal physiological processes are interrupted and how the body works to return to homeostasis. The typical questions about abnormal values on our exams and standardized tests will have values that are way off the normal range, usually. For example, patient has a total serum calcium level of 14.5 milligrams per deciliter. How would you classify the patient's blood calcium level? First of all, you need to know what's the normal range for calcium. Normal is 8.2 to 10.2 milligrams per deciliter. Well, this patient has 14.5 milligrams per deciliter. So how would you classify the patient's blood calcium level? It's going to be hypercalcemia. If you have any questions on these, please do not hesitate to ask. And then as you go over this, you're going to feel the knowledge just increasing by leaps and bounds. It's going to be a lot of fun.